Welcome back. We're still talking with Kimme Everman, a program officer with Montana's Office on Aging. Thanks for sticking around with us, Kimme.
Absolutely.
So before the break, you did talk a little bit about SHIP counselors. Can you talk, that's a state plan. What is SHIP?
You know, thank you so much for letting me talk about SHIP because they are the most wonderful advocates that you could find. They're a statewide network of counselors who are extensively trained in Medicare, and the SHIP piece of it stands for State Health Insurance Assistance Program. There's one in every state in the territory, so we are a national program, and they are delivering no cost, objective information to the beneficiary or the beneficiary and their family or just the family. Whoever needs that information can come to the table. And I'm just going to read the list because there's so many things they do. They do counseling on Medicare, of course, dual eligibility, which is Medicare and Medicaid, Medicare prescription drug plans, supplemental insurance, and the Medicare health plans that we talked about, which are the Medicare Advantage plans. They also are going to help that beneficiary identify any kind of support program that might be available to them, meaning there are some programs that can help people pay for their Medicare. And it is certainly a hand up, not a handout, and we really try to get folks on board if they look like they might be eligible to apply. And a good thing to remember is that we will see or work with anyone who has Medicare. So you don't have to be 60 in order to get it. You can come and see a SHIP counselor as long as you have Medicare.
Okay, and SHIP counselors will even come to your house, is that right?
Yeah, that's true. There are always folks, especially some of the frailer ones that we work with, who cannot travel to a SHIP site. So sometimes if they need to, the counselor will go to their house and have a home meeting with them. So it's a very nice way for Montana to cover all those miles.
Really great. And you said no cost. Is there ever a time when there's a charge for SHIP services?
No, never a time. You know, certainly if a person wanted to give a donation, that's up to them, and we would, you know, we wouldn't say no because it's so helpful to our programs. But there's never going to be any kind of bill, or you know, you're not going to get something in the mail that says you owe $50. Nothing like that. And I'm glad you brought that up, Beth, because if someone on TV or on the internet is saying they'll do stuff like this for you for a cost, call a SHIP counselor first, because we will do it for you as part of the fact that you're a citizen of the state of Montana.
Perfect. And so if folks don't cover the cost for SHIP, where does that money come from? How is SHIP funded?
Well, SHIP is federally funded by the Administration on Community Living, and they are also where they administer the program. That's where I always say the marching orders come from. And SHIP came to be in 1992. Congress standardized those supplemental program or policies we were talking about earlier. And Congress decided that people needed people that could help them decipher all that information. And all these years later, we've really evolved into a great advocacy point and resource for beneficiaries and their families.
So great. And you mentioned too that there are folks on Medicare who might be able to get a little extra help, a hand up, not a hand out, as you said. Can you talk about that a little bit more?
Certainly. There's a couple of things. First of all, Medicare Savings Program. And that's a program that's going to help you pay for your Part B. And then there's also the low income subsidy, or LIS, you might see it as, and that helps pay for the Part D, so the drug coverage. Either one of those does have asset limits and some limits to income and that kind of thing, but you don't know till you try. So go to a SHIP counselor and ask to have some assistance applying for those programs if you haven't already. The worst they can do is say no, and that's not so bad always.
Right. So does SHIP also help Medicaid members or just Medicare?
Yeah, in a way. We have many, many folks, especially senior folks, who are Medicare, Medicaid eligible, which makes them dual eligible. And as long as that Medicare piece is in the mix, yes, the SHIP is going to work with that person, and more and more, although they are not the Medicaid experts, they certainly know how to fill out the applications and who to call if there's a problem.
You've mentioned dual eligibility a couple of times now. Can you talk about when somebody might benefit from that?
Yeah, you know, we have a lot of folks in Montana and all over the nation, seniors who are making very, very, very low wages every month or benefit every month, and they cannot make it all go far enough. And so we feel like helping them find these programs we always say, you know, if you get the MSP, for instance, the Medicare Savings Program, that's about $130 back in your bank account that you can spend on food or medicine or whatever you want, and it will help you have a better life.
If someone is dual eligible, are they still able to take advantage of the annual enrollment plan with Medicare? Does that get tricky?
No, they absolutely can, but that's a great question, Beth, because if you are dually eligible, you actually have an ongoing enrollment period, which means you can enroll in a different plan every month if you want. Now, obviously, we don't want that to happen. That's a lot of chaos for that beneficiary in changing. But Congress decided that Medicaid beneficiaries are a group that should get an extra special enrollment period, and so they get one every month. And so working with those folks can be a little bit easier, actually, because if they're in a plan that doesn't work for them any longer, we can at least get them out the next month.
Okay, perfect. Kimme, we do need to pause here for another quick break. But the Medicare annual enrollment period is going on. Are you missing out on potential cost savings by not switching plans? You won't want to miss this next segment. We'll be right back after these messages. Stick around.